We will talk about hay fever, including how to detect it, the top 5 signs and symptoms, causes, and treatment. First, we should say that hay fever has several names: seasonal allergy, pollinosis, and allergic rhinitis. They all describe the same condition, which occurs when a person has an allergy to pollen from trees and grasses. Symptoms usually worsen in the spring and summer seasons. The first and most common symptom is sneezing. This is different from occasional sneezing because it can occur 5 to 10 times in a row and happens several times a day. Such intense sneezing indicates an allergy. Sneezing occurs because the body's immune system reacts to pollen by releasing histamines, which irritate the nasal passages, causing the person to sneeze in an attempt to expel the irritants. The second most common sign is a runny or stuffy nose. Nasal discharge is usually watery and clear, and this discharge often alternates with nasal congestion. This means the person sometimes feels their nasal passages are blocked, and other times they have a runny nose. Nasal congestion can be significant enough to cause mouth breathing. It happens because histamine released during an allergic reaction causes blood vessels to dilate and increases mucus production. The third symptom is red, itchy, or watery eyes, which are very common during pollinosis. All these symptoms can range from very mild to severe, depending on individual factors. Pollen irritates the conjunctiva, the clear tissue covering the white part of the eyes and the inside of the eyelids. The fourth common sign is an itchy throat and coughing due to allergic irritation. This happens because excess mucus from the nose drips down the throat, causing irritation. Lastly, fatigue and headaches are common but not very specific symptoms of hay fever. Sometimes, blue-colored skin under the eyes, called allergic shyness, is present. This occurs due to nasal congestion and poor drainage of blood from the veins around the eyes. Hay fever develops because allergic reactions occur when the immune system mistakenly identifies pollen as a harmful substance. It then releases histamine and other mediators, causing the allergic reaction and the aforementioned symptoms. This allergy is not limited to tree pollen. It can also be caused by dust mites, pet dander, or mold spores, as well as cigarette smoke or any strong odor or chemicals. Symptoms of hay fever usually worsen seasonally during spring, summer, and autumn but can sometimes occur year-round. Regarding long-term risks, hay fever doesn't directly affect lifespan but is commonly associated with asthma. A significant portion of people with seasonal allergies will develop asthma later in life. Coughing and discomfort during breathing are also common without asthma, occurring in almost 20% of hay fever cases. For diagnosis, symptoms combined with a skin prick test are common. This test involves introducing small amounts of allergens into the skin and observing for a reaction, known as the wheal and flare response. Additionally, total immunoglobulin E, IgA, levels can be determined, but this test is not very informative because IgA levels are not specific to allergic rhinitis and can be normal in many cases. A more specific test, called immunocap, defines specific antibodies against pollen. If pollinosis is left untreated, it can cause chronic sinusitis, ear infections, nasal polyps, sleep apnea, and low sleep quality. The first-line treatment for allergic rhinitis includes antihistamines such as cetirizine, loratadine, or fexofenadine, usually taken once daily. These medications can be used throughout the allergy season or as needed and provide quick relief, typically within 1 to 2 hours. They relieve itching, redness, and nasal congestion. Nasal corticosteroids, such as fluticasone, mometasone, and budesonide, are more specific for nasal symptoms. They are recommended to start before the allergy season begins and continue throughout the season. These medications act slowly and may require several days or up to a week for full effect. Among supplements, quercetin is effective as a natural antihistamine and anti-inflammatory, typically taken at 500 mg twice a day. Vitamin C supplements may also help due to their antioxidant activity. Probiotics, such as Lactobacillus rhamnosus, can help modulate the immune system and reduce allergic responses. To prevent or minimize rhinitis, stay indoors on high pollen days, especially in the mornings when pollen counts are highest. Use weather apps or websites to check daily pollen counts. Allergy shots or sublingual tablets can also be effective. These treatments gradually desensitize the immune system to specific allergens and are usually administered over several years.